Hello, everyone. My name is Heather Trumm, and you are listening to Industry Matters. I am the Director of Wound Care at VGM, and we are super excited to have Amanda Smithey online here today, or on the podcast, I should say. Amanda Smithey, she is from McKesson, and we have worked in this field for some time together. We're going to talk today about identifying the need in the market. So I am going to let Amanda talk a little bit and introduce herself and talk about her past experiences. So thanks for joining us, Amanda, and welcome to the podcast.
Thanks, Heather. So, hello, everybody. It's great to be out here with everyone on this podcast today. Again, as Heather mentioned, my name is Amanda Smithey. I'm our Senior Manager for Advocacy and Strategic Partnerships for the HME Division at McKesson. And I think really the important thing to know about what I do currently is my goal is to come up with ways for HME providers to streamline their operations and to figure out how to grow in the space. And we all know that is extremely challenging with the fact that we're not getting any kind of reimbursement rate relief. And it seems like we're constantly getting squeezed in margins. So we've got to get creative. We've got to do things more efficiently, less overhead. And then we've also got to branch out and sometimes get out of our comfort zone and go into product categories that we're not typically used to servicing. So it's a little bit about what I do. Prior to being here at McKesson in this role, I was an HME provider for over 15 years. Wound care was always my niche product category. I loved it. I'm not sure why I gravitated towards that, but it caught me, and it's been one of my passions for a long time in this specific industry.
Awesome. Thank you so much for that, Amanda. What we're going to talk about today is we talk about we get a lot of questions about how are you successful in the wound care market? And Amanda always lays out 5 steps of what is important to be successful in the wound dressing. And I guess you can use it in other aspects of wound care as well, the various categories. But we are going to go through a series of podcasts here, Amanda and I, and we're going to break it down. So this will be the first of 5 podcasts, and we're going to just start with step 1. And step 1 in becoming successful in the wound dressing market is identifying the need in the market. So, Amanda, what are the market segments and how do you go about identifying them?
So I think really the first thing that I think about is when anybody comes up to me and they ask the question about wound care and they're like, should I get into the surgical dressing space? Or I know that it's complicated, and they can give me all the reasons why not to do it, but they really want to know like why they should do it. And then if it makes sense for them. And I always say there's a lot of reasons to get into it. One, it can be a very profitable product category. It's not a category that's currently a part of competitive bid, or when competitive bid rears its ugly head again, it's likely to not be a part of that. So that's attractive. Also, it is a challenging product category to get into. It's documentation intensive. You really do have to understand how to read wound assessments and to assess whether that assessment qualifies that particular wound in that patient for that particular treatment that's ordered. And with that being said, there's a lot of folks that don't get into it. So it's not a category that's saturated. So there's a lot of upside there. I think when you've got a category where the margins can be good, if you're paying attention to your formulary and the products that you're ordering, and you have a product category that's not saturated, there's a lot of upside. So why would you not do it? The other reason why I like the wound care space as well too is that it goes along with lots of other comorbidities. So when I say that, think about your diabetic population. So if you're servicing your diabetic population out there with CGM monitors, what else do diabetics also tend to have? Unfortunately, they tend to also have a lot of breakdown, and you see diabetic foot ulcers. So you also potentially could have an existing population that's already utilizing wound care, and they're getting it from somewhere else. So wouldn't it be nice if you could service them as more of a one-stop shop and providing them with more than just their CGM supplies, perhaps their wound care supplies too? So those are some of the things that I think about as to why it's attractive. But that doesn't necessarily mean that it's a good fit for you as an HME provider. I think that's where you got to do a little bit more digging in terms of figuring out why it's a good fit, or why it could potentially be a good fit for you.
Okay, and let's talk about that. What are some of the things that we should look into and dig deeper into our own business to see, is this a good fit for me or not?
So I think the first thing is, and this goes for any product category that you're trying to think about
Mm-hmm.
getting into, or even if you're just trying to figure out what product category should I get into, I always recommend number one is that you sit down with your resupply team and you add to their current script that they have today with their patients and asking them the questions about what other medical supplies are they using today. And that's where you're going to also uncover, like, oh gosh, I've got this patient population that I may be servicing for incontinence supplies or feeding supplies. And it seems like 30% of them also have a need for wound care. And so that kind of directs you as well too. It also gives you an idea of where what I call your low hanging fruit is, because those are the folks that you're going to want to go after first. They're already used to your service. They're familiar with your company. They're your existing patient population, and you can just add on to what you now service to them. So I tell everyone, always do that. You should be doing that anyways all the time, just so that you learn and understand more about the patient. I know, Heather, you like to always say that we treat the patient as a whole and not just the hole in the patient.
Yes,
And that's
absolutely.
kind of what I think about when I'm talking about the resupply team and having those conversations. The second thing that I think is important is to go out and talk to your referral sources. And I always call these like discovery sessions, but find out from your current referral sources what they're doing for wound care. Do they see wound care patients? Do they write for wound care? And if they are writing for wound care, who are they using today? What do they like about that particular HME provider? What don't they like about that HME provider's process? Are they open to a potentially new provider in the space? I think that you can gain a lot of insights just from those, what I call again, those discovery sessions with your current referrals, and understanding like where the market is in terms of their surgical dressings and who they're using, what they're like, what they don't like. And it also helps you to build your program. So before you even get to the point of knowing, like, hey, I'm definitely going to jump into surgical dressings, you already have intel for how you need to formalize your program moving forward. So that's why I think that those discovery sessions are so important. And I also say, don't just do your existing referrals. Like, let's say, okay, you've had the conversations with your patient population. Sounds like you got some patients that have a need for wound care. You're doing product categories today that you know tend to also lead patients to having wounds. So, okay, that checks. You've talked to your referral sources. They're open. They don't have a really solid HME provider today that's providing them with those wound care supplies. So they're open to somebody else coming into the space. Then you want to check out some of your like prospects. And when you think about prospects, I always talk about like, so where are wounds? And the other good thing is that unfortunately, wounds are everywhere. There's not just a set
Yes.
place. Not all wounds go to wound clinics. I mean, that's an obvious one, but think about the podiatry offices. Podiatrists are seeing all of those diabetic foot ulcers. So that's another place that you can go to that you may not be calling on today to get referrals. In addition to that, we also have home health agencies and you have
Mm-hmm.
long-term care facilities. A little bit different that how you would
Yeah.
handle HHA and long-term care, but that's a huge source of wounds for patients, and there's a giant need there. They definitely don't have as many HME providers knocking on their doors, and that relationship between the HME provider and the HHA or the long-term care facility can save that organization a lot of money and help them take care of those patients and have better outcomes. So don't forget those types of referral sources as well too. I do say though that if you start to go the HHA and long-term care path, make sure that you've got a solid footing on wound care first. Don't start there. I would definitely start with the more traditional referral sources like your wound clinics, your podiatry offices. And then once you've got a good grasp on that, just know that now you can build and then start building into those other referral markets.
Absolutely. And some of the other referral markets too that wounds come out of are vascular offices. That's another
Mhm.
one. Rehab facilities. There's a whole listing. And I do want to point out that VGM, we do have a wound care guide and a wound care manual. So if you're VGM members, we have this listed all out in our wound care guide and wound care manual. And if you do want to dive a little deeper into the skilled facilities and the HHAs, Amanda and I would be more than happy to talk to you about that, because it is a little different point of service in regards to how you would go about it and in the billing aspect as well. Thank you for that. That was a great explanation. I do also want to just throw out there, what do you think about market data, and how can that help you identify the need in the market? The market data is a division of VGM. So tell us a little bit where you think that can help.
I think it's a great spot to go where you can figure out which physicians are writing scripts. And I think that's the
Perfect.
kind of direction that you want to use any kind of market data that you can get your hands on, because it tells you who's writing. And if you know who's writing, then you know who to call on. And that alleviates a lot of the, you know, cold calling. I think
Questions.
using market
Yeah.
data turns everything into, it turns it to a warm lead as opposed to a cold lead. So I'm a huge proponent of using market data in terms of helping to direct where you should send your sales and your marketing team and put more of your effort into, as opposed to just that cold call and kind of going around blindly for it.
Awesome. Thank you for that. Another question I have for you. So, as you're going and identifying the need in the market, what are some of the strengths that you can see that a DME has within their own organization? Maybe some strengths that will help you, and maybe some weaknesses that you can turn into strengths as you're going out there.
I think one thing that can be a strength and that also can be a weakness is your own team as an HME
Mhm.
provider. So you really do need to evaluate your own team to make sure that they have the ability and that you feel that you can train them to be able to take on surgical dressings. If you've got a team that's already strapped and they just don't have the time, they're not used to having conversations back and forth between the clinician that's writing the scripts and themselves, then it might be a challenge. So you've got to make sure that you've got the right team. And I think that this is where you have to be honest with yourself. Like, do I have the team in place that can be successful in this? And when I say that, what makes a team successful, and again, this is where I say it can be a strength, is that you really, in the wound care space with billing, you're the expert. And the clinicians do not know. It's too much for them to remember that an alginate requires a full thickness wound with moderate drainage. They're going to send over an order that's not going to match. And what makes a strong provider in the wound care section or space is when they can go back to that clinician and say, hey, you sent over this assessment, it looks great. Unfortunately, I'm showing that the patient has minimal drainage, whereas you ordered an alginate, and alginates are not reimbursable for that. So here are your options that you can do. If this wound truly is minimally draining, then these are the products that are reimbursable that you could write for this particular patient. Or if you feel like that wound is actually moderately draining, maybe because when they did the dressing change, they didn't pay attention to the fact that the dressing itself was saturated. They didn't see anything on the wound, but that's because the dressing was doing its job, and the drainage is actually there in that dressing. So it's still a moderately draining wound. It just doesn't appear that way because you got a dressing that's doing its job. If they decide, oh, you know what, it really is moderate, they're going to adjust their assessment and then send that back over. That's what makes a successful HME provider in the surgical dressing space, is that they have the ability to communicate with those prescribers, to talk to them about when something's reimbursable, when something's not, and what their options are. With that being said, too, when you look at your sales and marketing team, I think a big successful proponent of that team is that they're able to educate those referral sources as well, too, on how it works. So I'm a huge fan of doing in services. They're very short. I mean, I think I try to keep my in services for referrals to about 20 minutes, just kind of going over like how it works. Like, how does the order process work? What's allowed, what's not allowed. And the reason being is I don't expect them to remember all of that, but I want them to understand it so that way when they do have an issue and we come back to them and say, hey, this isn't going to fly, they're like, oh yeah, I remember that now. So there's a lot
Perfect.
of
Yes.
training that goes back and forth. So that's one thing when we talk about like evaluating your current team. The other thing that I think makes folks successful in the space is, as we know, there's all sorts of technology that's out there now. And you do really need to be savvy with technology if you're going to continue and you're going to grow in the HME space. And so understanding what currently the systems are that your referral sources are using are very important. Are they using like any e-prescribe platforms? Are they on a Parachute? Are they on a DME scripts or something of that sort? There's a program out there called Wound Expert. Are they using any kind of like assessment documentation tools like a Swift or something like that? So understanding those different technology pieces and being able and flexible to be able to work with those will also make you successful in this space as well too.
That's perfect. All right. Oh, I think we nailed it. You nailed it on identifying the need in the market. Is there anything else you want to add to that in regards to identifying the need of wound care, surgical dressings in the market?
I don't think so. I think they're really just, get out there and do the research, like have the conversations.
Yes.
That's the place to start. You may uncover that there's an additional product category in addition to wound care that makes sense for you to tackle. So you don't know until you have the conversations. And I think that sometimes we don't take the time to do the pre-work. And that's what all this is just pre-work and getting you better prepared to building the program that you need to build to be successful in your space.
I love it. That's perfect. Awesome. And what is the next podcast, Amanda?
So the next one is the one where we're going to actually talk about building your program. So after you've done your pre-work and you figured it all out, you know that you've got an opportunity. So now what? What do you do now? And there's a lot that goes into building it. So that one's going to take some time for us to kind of flesh out like the different pillars within that particular step. But that's a good one.
Awesome. So this is a great lead into that. And that one will be a little bit longer, but there you go. Amanda Smithey talking about identifying the need for surgical dressings in your market. Thank you so much. And I am looking forward to this series of podcasts and uncovering everything that we need to let everyone know on how to be successful in the wound care market. So thank you, Amanda. And thank you, listeners. We look forward to the next one. Talk to you soon. Bye-bye.